Thank you. I'm Charlee Alexander. I'm a program officer at the National Academy of Medicine, where I direct the Action Collaborative on Clinician Wellbeing and Resilience. So welcome to our meeting on redesigning the clinical learning environment, and welcome back to those of you who joined us for the storytelling event last night. I want to thank again Tom Nasca and the ACGME for hosting us this morning and for the hard work of the ACGME staff team in preparing for this event. I also want to recognize the Planning Committee for their months of thoughtful planning to shape our agenda today. If you are on the Planning Committee, please stand. We couldn't do this work without our committed sponsors who are listed and included in your briefing material. So thank you very much for providing the resources for us to continue this work. And a big thank you to my NAM team, Amani, Mar, Kira, Ivory, Sammy, and Cheryl for all that you do for the Action Collaborative. The Action Collaborative launched in January 2017 with 3 key goals. The first, to raise visibility of clinician burnout, depression, moral injury, and suicide. The second, to improve baseline understanding of challenges to clinician well-being and the consequences for clinicians, patients, and the healthcare system. And finally, to advance evidence-based, multidisciplinary solutions that will improve patient care by caring for the caregiver. To achieve our goals, we organize ourselves into working groups, and we have about 65 working group participants representing medicine, nursing, pharmacy, dentistry, professional societies and membership organizations, government agencies. We have health IT vendors, large healthcare centers, payers, researchers, trainees, and patient and consumer perspectives. For our first 2.25 years, the working groups were focused on laying the groundwork for our efforts, and we had 4 groups dedicated to research, data, and metrics, put out several tools and discussion papers. We had a group that developed the conceptual model of the factors affecting clinician well-being and resilience, a group focusing on external factors and workflow, which really explored documentation, the digital health environment, and team-based care, and a final group focused on messaging and communications, and that group is the one that put together our Clinician Wellbeing Knowledge Hub. But to really close the gap from where we are to where we want to be, we need to modify our approach and move towards action, engagement, and implementation. And so our new groups will focus on leadership engagement, on breaking the culture of silence, on organizational best practices and metrics, on workload and workflow, so that consists of administrative tasks and the EHR, post-2020 sustainability planning. So our current funding ends in December 2020, and that group is going to focus on how we're going to continue this work into the future. And then finally, I'll talk about this in the next couple of slides. We have a consensus study coming out this fall on systems approaches to improve patient care by supporting clinician well-being. And so we have a ready and willing group in the Action Collaborative that can begin work on the next step for the recommendations, and that's what one of the focus groups will be for the collaborative. Yesterday, the Action Collaborative released a discussion paper, Gender-Based Differences in Burnout, Issues Faced by Women Physicians. How many folks have seen that or have had a chance to take a quick look? Yes, excellent, good. The authors note that individual, institutional, and societal risk factors for the development of burnout can differ for women and men physicians. And while some studies on physician burnout report an increased prevalence among women, this finding may be due to actual differences in prevalence, the assessment tools used, or differences between and among the genders and how burnout manifests. So the authors review the prevalence of burnout in women physicians and contributing factors to burnout that are specific for women physicians. Here's an excerpt of the statement of task for the consensus committee, which I mentioned a moment ago. The committee is examining the scientific evidence regarding the causes and consequences of clinician burnout for clinicians and patients, and the evidence regarding interventions to support clinician well-being. They're examining components of the clinical training and work environment that can contribute to clinician burnout in a variety of care settings, as well as potential systems interventions to mitigate those outcomes. They are identifying promising tools and approaches to support clinician well-being, identify gaps in the evidence base, and propose a research agenda to address areas of uncertainty. And the report will issue recommendations for systems change. We are expecting the report in mid-September, and I've included 2 National Academies reports here. The first to err is human, which identified high rates of medical error driven by a fragmented care system. And the second is crossing the quality chasm, which focused on how the health system could be reinvented to foster innovation and improve delivery of care. These reports have driven transformative change in healthcare delivery, and we hope that an NAM report on clinician well-being will have a similar impact in the field. Our meeting objectives for today are included in your materials. We are going to explore what we value as healthcare professionals and how to change culture by focusing on human connection, along with productivity and efficiency, so that we do the best for our patients and for ourselves. We're going to elevate areas of agreement around redefining well-being, identity formation, and professionalism. We are considering the clinical learning environment today as an ecosystem that includes interprofessional health students, trainees, and practitioners across disciplines and specialties. We're highlighting drivers of challenges to clinician well-being in the learning environment and proposing systems-level solutions for improving well-being. We're emphasizing the tension and the linkage between the learning and working environment, and we are doing all of this using an appreciative inquiry approach, which we will talk a little bit more about later this morning. Here's our schedule at a glance. We have a few keynote presentations, and then we're going to go into our first table discussion. Today is very discussion-based, so I hope everyone came ready and excited to engage. I'm an introvert, so it's normally terrifying, but hopefully today the introverts in the room will find a safe space and enjoy the conversation. After our first table discussion, we'll move into our personal narrative, followed by a second table discussion, and then a leadership narrative, followed by a third table discussion, and then we'll reflect and have some closing remarks. We're joined by a number of esteemed speakers today who will take us on a journey through today's program, but to save on time, we're not going to read their bios, and instead those are in the electronic briefing materials. We encourage you to get involved with the Action Collaborative by signing up to become a network organization. I've included the link in the slide here. And just as a note, all the slides will be available online for those speakers who agree to post their slides online. Network organizations are groups that have provided 1 to 2 page commitment statements highlighting current or planned activities to advance clinician well-being. They participate in our research surveys, identify content reviewers for our resources, and speakers for our meetings, and otherwise amplify our activities. So just a quick housekeeping note before we move on to the program. We have about 750 people joining us via webcast. So for those of us in the room, please always use a microphone. Don't get started. Don't think you have a loud voice and everybody can hear you. We really need you to use a microphone. And for one of our keynotes this morning, we're going to run the mics, but afterwards we will not. So if you have any questions or comments, please always make yourself to the standing mics that are in the center and edges of the room. Okay. Well, now it is my pleasure to introduce Tom Naska, President and CEO of ACGME and ACGME International, and co-chair of the Action Collaborative.